Good morning. With our kids headed back to class in a few weeks, we're here this morning to draw attention to St. Louis County's back-to-school vaccination program. St. Louis County Department of Public Health offers low-cost or no-cost vaccinations Monday through Friday at all 3 permanent locations, including this one here, the John C. Murphy Health Center in Berkeley. And those will run through September 1st. Getting your children vaccinated is an important part of their growth and development. It gives them the best chance to stay healthy and let them focus on learning and doing the things that they love to do. Child and adolescent vaccinations are a big part of their long-term health and well-being. Unfortunately, the pandemic had a negative impact on vaccinations here locally, but also across the nation. Here's one example. The CDC has reported that 61 million measles vaccinations were either postponed or missed during the COVID-19 pandemic. So if your kids are behind on their shots, bring them to one of our clinics so they can get caught up and give them the best chance at staying in school and getting a full benefit of their education. The vaccines that we administer in our back-to-school vaccination program include varicella, the chickenpox vaccine, DTP, diphtheria, tetanus, and pertussis, MMR, which is measles, mumps, and rubella, polio, a meningococcal vaccine, and hepatitis B. We also offer to all of our residents, as well as our kids, the COVID-19 vaccinations. The CDC recommends that everyone over 6 months of age get either the Moderna or the Pfizer vaccine. And we know that these are safe for our young children. We're happy that COVID-19 is no longer part of a pandemic, but it's still very much among us. It's very active in our community. And for the last several years, we've seen COVID infections surge in the fall, leading to interruptions in school. So please, if your child hasn't been vaccinated for COVID-19, when you're getting your back-to-school vaccinations, get the COVID vaccine as well, along with your regular shots. So now I'd like to introduce Dr. Kanika Cunningham, who can give us more details about our vaccine program. Dr. Cunningham is the director of the St. Louis County Department of Public Health.
Thank you, Dr. Page, for welcoming me, and thank you for always supporting the Public Health Department as well as our communities when it comes to health and wellness. So thank you all for this opportunity to talk a little bit about our vaccines that's being offered. As Dr. Page has stated, this is an opportunity to get vaccines at little to no cost here at any of our 3 health centers. So at John C. Murphy, our North Central location, as well as our South County location. Vaccines are being offered from 8:30 to 11 o'clock and closing for lunch and then reopening again from 12:30 to 4 p.m. There's one exception. This Friday, our COVID-19 vaccination clinic will be closed due to staffing issues. There's no appointment necessary. However, I do encourage everyone not to wait to the last minute to start early with getting your vaccinations. What we do see is the week before school, individuals like to come in as long wait lines, so please take this opportunity to start getting your vaccinations earlier and avoid the rush. Students are asked to bring a copy of their shot records as well as an insurance card if you have one with you. There may be a charge depending on the insurance policy, but we make sure everyone get their vaccinations regardless of your ability to pay. Missouri students must be current on very specific vaccinations before starting the school year. For more information about those specific vaccinations, please visit the Missouri Department of Health and Senior Services website. All vaccines that we administer to children, including the COVID-19 vaccine, has been proven to be safe and effective. Throughout our county's history, vaccines have saved countless lives, and they continue to do so today. As Dr. Page said, staying up to date on childhood immunizations and getting a COVID-19 vaccination both contribute to maintaining your child's health and ensuring they are well prepared to learn. Please visit one of our 3 DPH clinics for little to no cost vaccinations. And if you're in need of a pediatrician, please speak with one of our health staff, and we're happy to get you set up to be a new patient. Thank you.
Glad to answer any questions.
What makes the clinics that you guys are offering, either for you or Dr. Cunningham, what's so important about these for people in our community? Is this chance for people who maybe can't get them elsewhere, maybe don't have a regular pediatrician set up, or what makes what you guys are doing here important for families in our area?
Take that.
Yeah. I think one thing that it offers an access point to care. So I agree, a lot of people may not have a pediatrician or think about primary care until there's an acute need. If someone do not have a pediatrician or primary care doctor, coming here is that first step to connecting to care. One thing we will do, if we do identify that you don't have a ongoing physician, we will offer you to establish care here at the clinics. I think the other thing for our health departments is that in the county, we serve those who are underinsured as well as uninsured. So I think that makes us unique, that we're able to work with individuals and take care of them regardless of their ability to pay.
What's your message, Dr. Cunningham, to families if they can't pay? You alluded to it there. You said there's a charge for these vaccinations, but you'll work with people. How does that
Correct.
work?
Yeah, so when you come in, talk to one of our nurses. We're happy to, we offer a sliding scale here, so based off of your income. And that's why we say that some vaccinations can be free, or they could be a low cost. But I encourage anyone to speak up with your status, and then we'll definitely work with you, complete any paperwork that we need. But the biggest thing is we're not going to turn anyone away. We want to make sure that our kiddos are vaccinated and that they're ready to return to school.
I know you mentioned the pandemic. Are you seeing less kids? Can you just talk about the impact of that? Are you seeing less kids getting vaccinations?
Yeah, so hopefully this year there is a big push for us to really encourage childhood vaccinations. During the pandemic, we did see that there was a drop, and part of it was because a lot of us switched to telehealth. It created a disruption in the healthcare system that we had to quickly adjust to. So we did see that routine vaccinations, well child visits dropped. So there's really a big push around the country as well as locally here for us to make sure our kids are up to date on our vaccinations.
Thank you.